Hi, I'm Lisa Squires, Senior Communications Advisor with Alberta Health Services, and this is Health Matters. Joining me today is Dr. Ken Sauer, and he's the chair of the Palliser Triangle Health Advisory Council. And we're going to be talking today about the role of the Health Advisory Councils and how they're working with Alberta Health Services to ensure that Albertans have quality healthcare services. Thanks, Ken. So first off, why don't you start by telling me what is a Health Advisory Council and how many do we have within Alberta Health Services?
Well, the Health Advisory Council has really been set up in terms of a replacement for the community health councils that were here before we were regionalized. And what happens here, of course, it's a representation of all of the communities in this southeast corner, and we are there to represent the citizens, to tell people in Alberta Health Services what's going well, what needs to be corrected, what concerns are being raised, what kind of trends are being identified in our communities.
And so how many health advisory councils are there throughout the entire Alberta Health Services?
There are 9 of us.
9.
And we're divided up into zones, by the way. We are in the south zone, which means Lethbridge and us. And there are, around the Calgary area, there are 3 of them type of things. So, but we take care right from the Crow's Nest border right up to the Saskatchewan border.
And how many members are on the Palliser Triangle Health Advisory Council?
We have 15 of them.
How is it that you guys take the voice of Albertans back and make sure that that voice is being heard?
Well, first of all, I think every one of us who are on that particular Health Advisory Council are passionate about health and making sure that every individual has that opportunity to live healthy, stay healthy, and be looked after if they're not. And of course, that's our biggest concern, by the way, is trying to get people to educate themselves to make sure that they stay healthy. There's the old participation, and it's come back again, participation. I don't know if you remember that, but they used to say that for every dollar spent on health, 95 cents was spent on cure and only 5% on prevention. So all of us on our Health Advisory Council, and I'm sure it's the same thing for everybody else, is we're trying to make sure that people do the right things, eat right, exercise and things like that, so that they can stay healthy, because there are only so many dollars around to look after people who are sick, and some of the drugs that are available are expensive.
And how can people get involved with their local Health Advisory Council?
Well, first of all, you have to just trust us that we're going to try to help you as much as we can. Now, we don't have all the answers, and neither do we have all of the instruments to get an answer for you. But we do try our best to support you to make sure that if you have a chronic disease or if you're having problems trying to get an appointment along the way, we can't force somebody to take you on, but at least we can advocate and say, this person really needs some attention as close in the future as possible. And those are the kind of things we do. It's just a kind of a supportive person. So depend on us. Depend on us to help you as much as we possibly can.
Where can they go for more information?
Well, there are 2 ways. My name is in the phone book, and it's 403-526-6259. HealthLink is another way, and of course there's the opportunity to in your own community, like 7 persons or Bowen, to find out who your rep is and take care of it, because the names are out there, and let's just make sure that we're there to help if we can.
Thanks, Ken. That's some really great information. And thanks to all of you for watching, and thank you to all the members of the Health Advisory Council for all the work you're doing on our behalf. I'm Lisa Squires, and this is Health Matters.